Good morning. My name is Harnik here, and I'm going to talk about my quest for medical quizzes. Today we have a new quiz, which is quiz number 2. You are caring a patient who is being mechanically ventilated on assist control mode at rate of 10 per minute. Tidal volume 800 milliliter, FI 250. ABG at present setting is pH 7.28, PaCO2 65 millimeter of mercury, and bicarb is 19 milliequivalent per liter. Find the appropriate respiratory rate and desired PCO2 to achieve the desired pH, which is 7.40. How we calculate, there will be 2 steps. In the step 1, let's find out what is given first. We have given AC, assist control 10 rate per minute, tidal volume 800 ml, and then we have FI2. 0.50. So the ABG was done. pH was 7.28. PaCO2 65 millimeter of mercury, right? And bicarb 19 milliequivalent per liter. We have to find out the respiratory rate, nu, and PaCO2 nu, to correct ABG. pH will be corrected. Okay. So let's find out the new PaCO2, what we need the PaCO2 to correct the respiratory rate and correct the pH. Let's do that. PaCO2 nu. Formula is bicarb divided by 0.03 multiplied by anti-log of pH, which is 7.40 minus 6.0. We will talk sometime other when we will be studying the blood gases. So if this formula will give us the new PaCO2, required PaCO2 to correct the respiratory rate and to correct the pH. If we look at this, the bicarb is 19 milliequivalent per liter, that's given, divided by 0.03 multiplied by anti-log of 7.28. That's what is the pH given to us, minus 6.0. That is given. So now we have to solve the interlog first. Interlog, if you look at this, let's make it more simple. Divided by 0.03 multiplied by interlog of 1.28, because when you take out 7.28, 6.0 from 7.28, that's what the answer is. So interlog of 1.28, answer is 19.5. So let's go. 19 divided by 0.03 multiplied by 19.5. If you find out the answer, what will be the calculation of 0.03 multiplied by 19.5? The answer will be 19 over 0.985, which will give you the answer 31.6 or 32 millimeter of mercury. That's what we need, new PaCO2. So this is our new PaCO2. Okay, let's go to the next one. New PaCO2 is 32 now. Millimeter of mercury. That's what we need. And current rate, raster rate set is 10 per minute. So we call in raster rate is the frequency. Frequency 1 is equal to 10, which is first raster rate set, okay, per minute. And the PaCO2 blood gas currently showing 65 millimeter of mercury. And new PaCO2 we know now is 32 millimeter of mercury. And new raster rate we need to find, which will be concept called F2. This is what we need to find out. So if you put into formula F1 multiplied by PaCO2 old one, whatever is given, is equal to F2 multiplied by 32. That's what is the 32. And here is 65. That F1 was 10. So 10 multiplied by 65 is equal to F2 multiplied by 32. If you solve that, F1, let's solve it again, F1 multiplied by PaCO2 old one, ABG one, which we have right now. ABG done and is equal to F2 multiplied by new PSU2. Now let's put it into this. F1 is 10 rested rate, and the old PSU2 was 65 millimeter of mercury, is equal to F2, we do not know, and new PSU2 was 32. To find out the F2, you have to 650 divided by 32. So if you find out that, it will be 20. So F2 will be 20. So the respiration rate has to increase to 20 to compensate ABG to normal pH. You understand? Very simple. Simply you have to put some, you have to have the calculators to find out the antilog to solve these type of questions. They generally they don't put it into NVRC exams or some other exams, but if they do give antilog, and so you can solve this question very easily. The formula I disclose, and it is well known formula, everybody knows, those are already in practice, or some nurses also know, the medical students. Okay, well, thank you very much for listening. I appreciate it.